Hey, River City Live. It is time for another Care for Kids conversation. And today we are focused on Epilepsy Awareness Month for the month of November. And I'm so glad to welcome Dr. Galan from Nemours Children's Health to help debunk some of the myths that we have surrounding epilepsy. We're so happy to have you.
Thank you for having me.
So, Dr. Galan, a big misconception about children with epilepsy after they receive their diagnosis, a lot of people are worried about them playing sports, getting engaged in activities, and you guys are saying that that's really not the way that the kids need to be living.
Yeah, I think one of the things that we really strive for when we treat kids with epilepsy is we want them to live as normal a life as possible. And so particularly if you're able to achieve control of your seizures with medicine, we want kids to participate in sports. We want them to be active in their schools and communities.
Yeah, I think it's so important. And like you said, you want them to be able to live that life as normally as possible. What are some of the new treatment options when it comes to making sure that they can live that normal life?
So there's been a lot of advances in epilepsy management over the decades. I mean, we've gone from 6 anti-seizure medicines to more than 38. So just from a medication option standpoint, there are a lot more medicines available. But for those that do not respond to medications, we have things like surgeries, devices, diet therapies that can be very successful treatment options.
Now, as a parent receiving this diagnosis on behalf of your child and even the child receiving this diagnosis, what do they need to look for in terms of that big picture, in terms of that lifelong photo?
Yeah, and I think one of the things I really try to focus on when I treat kids with epilepsy is one, knowing that a lot of children do outgrow their diagnosis. So the majority of kids with childhood onset epilepsy actually do stop having seizures prior to adulthood. But for those that don't, there are successful treatment options. Up to 75% will have treatment or successful treatment with medications, where the other 25% we may need to focus on other options, but those can be quite successful, including surgery, which can be curative.
And I always love, obviously, the patient-focused aspect that Nemours brings to each and every case. I asked you before you jumped on camera why you got into epilepsy, and you said that you really wanted to be able to deliver that kind of knowledge and that kind of really specific knowledge base to parents and children facing this diagnosis. What should parents look for? Should they be on the lookout for something when their children are young if they start exhibiting symptoms?
I think one of the most important things when treating someone with epilepsy is, one, finding a physician that understands what's going on, but also making sure that all the treatment options are available for your child with epilepsy. It's important to know who in your region is a complex epilepsy center, who has the ability to treat your child if they're not responding to medications, and how to seek that out.
Well, Dr. Galan, thank you so much for debunking those myths with us so that any child that receives an epilepsy diagnosis, number one, is in great hands with you and your team at Nemours, but also that they can live that normal, healthy life that everyone in the 904 and beyond deserves.